Hey, Alpha Nurses, I'm Licensure from alphanursguy.com. These are NCLEX practice questions. Without the way, let's get started.
When performing cardiopulmonary resuscitation, CPR, which of the following indicates that external chest compressions are effective? 1. Mottling of the skin. 2. Pupillary dilation. 3. Palpable pulse. 4. Cool, dry skin. The correct answer is 3. With CPR, effectiveness of external chest compressions is indicated by palpable peripheral pulses, the disappearance of mottling and cyanosis, the return of pupils to normal size, and warm, dry skin. To determine whether the victim of cardiopulmonary arrest has resumed spontaneous breathing and circulation, chest compressions must be stopped for 5 seconds at the end of the first minute and every few minutes thereafter. The nurse begins CPR on a 5-year-old unresponsive client. When the emergency response team arrives, the child continues to have no respiratory effort, but has a heart rate of 50 with cyanotic legs. The team should next: 1. Discontinue compressions but continue administering breaths with a bag mask device. 2. Establish an intravenous line with a large bore needle while preparing the defibrillator. 3. Begin 2-person CPR at a ratio of 2 breaths to 15 compressions. 4. Begin 2-person CPR at a ratio of 2 breaths to 30 compressions. The correct answer is 3. CPR is done on children for a heart rate of less than 60 with signs of poor perfusion. Rescuers should use a 15 to 2 compression to ventilation ratio for 2 rescuer CPR for a child. Breaths without compressions are indicated only for respiratory arrest where the heart rate remains above 60. The AED/defibrillator should be used as soon as it is ready, but rescuers should not discontinue compressions until the device is ready for use. The ratio for 2-person CPR in adults is 30 to 2. On finding a child who is not breathing, the nurse has someone activate the emergency medical system and then does which of the following first? 1. Clear the airway. 2. Begin mouth-to-mouth resuscitation. 3. Initiate oxygen therapy. 4. Start chest compressions. The correct answer is 4. When breathlessness is determined, the priority nursing action is checking a pulse and beginning compressions. After 30 compressions, the nurse opens the airway and gives 2 breaths. Oxygen therapy will not be initiated at this time because the child is not breathing. Also, administering oxygen therapy would interfere with providing mouth-to-mouth resuscitation. When developing the ongoing plan of care for the parents whose infant died of sudden infant death syndrome, the nurse should plan to accomplish which of the following on the second home visit? 1. Allow the parents to express their feelings. 2. Have the parents gain an understanding of the disease. 3. Assess the impact of the infant's death on their other children. 4. Deal with issues such as having other children. The correct answer is 1. The goal of the second home visit is to help the parents express their feelings more openly. Many parents are reluctant to express their grief and need help. The goal of the first visit is to help the parents understand the disease and what happened. The first visit also provides time to help the parents understand that they are not to blame. Although it is important to assess the impact of SIDS on siblings, this is not the primary goal for the second visit. However, the nurse must be flexible in case problems involving this area arise. Typically, parents are unable to deal with decisions, such as having other children during the second visit, because they are grieving for the child that they lost. This topic may be discussed later in the course of care. Parents bring their child to the emergency department because the child has stopped breathing. A nurse obtains a brief history of events occurring before and after the parents found the infant not breathing. Which of the following questions should the nurse ask the parents first? 1. Was the infant sleeping while wrapped in a blanket? 2. Was the infant lying on his stomach? 3. What did the infant look like when you found him? 4. When had you last checked on the infant? The correct answer is 3. Because this is an especially disturbing and upsetting time for the parents, they must be approached in a sensitive manner. Asking what the infant looked like when found allows the parents to verbalize what they saw and felt, thereby helping to minimize their feelings of guilt without implying any blame, neglect, wrongdoing, or abuse. Asking if the child was wrapped in a blanket or lying on his stomach, or when the parents last checked on the infant, implies that the parents did something wrong or failed in their care of the infant, thus blaming them for the event. When explaining to parents how to reduce the risk of sudden infant death syndrome, the nurse should teach about which of the following measures. Select all that apply. 1. Maintain a smoke-free environment. 2. Use a wedge for sideline positions. 3. Breastfeed the baby. 4. Place the baby on his back to sleep. 5. Use bumper pads over the bed rails. 6. Have the baby sleep in the parent's bed. The correct answers are 1, 3, and 4. Exposure to environmental tobacco increases the risk for SIDS. Sleeping on the back and breastfeeding both decrease the risk of SIDS. The sideline position is not recommended for sleep. It is recommended that babies be dressed in sleepers and that cribs are free of blankets, pillows, bumper pads, and stuffed animals. Co-bedding with parents is not recommended as parents may roll on the child. Which of the following outcome criteria would a nurse develop for a child with cystic fibrosis who has ineffective airway clearance related to increased pulmonary secretions and inability to expectorate? 1. Respiratory rate and rhythm within expected range. 2. Absence of chills and fever. 3. Ability to engage in age-related activities. 4. Ability to tolerate usual diet without vomiting. The correct answer is 1. After treatment. The client outcome would be that respiratory status would be within normal limits, as evidenced by a respiratory rate and rhythm within expected range. Absence of chills and fever, although related to an underlying problem causing the respiratory problem, do not specifically relate to the respiratory problem of ineffective airway clearance. The child's ability to engage in age-related activities may provide some evidence of improved respiratory status. However, this outcome criterion is more directly related to activity intolerance. Although the child's ability to tolerate his or her usual diet may indirectly relate to respiratory function, this outcome is more specifically related to an imbalanced nutrition that may or may not be related to the child's respiratory status. When developing a recreational therapy plan of care for a 3-year-old child hospitalized with pneumonia and cystic fibrosis, which of the following toys would be appropriate? 1. 100-piece jigsaw puzzle. 2. Child's favorite doll. 3. Fuzzy stuffed animal. 4. Scissors, paper, and paste. The correct answer is 2. The child's favorite doll will be a good choice of toys. The doll provides support and is familiar to the child. Although a 3-year-old may enjoy puzzles, a 100-piece jigsaw puzzle is too complicated for an ill 3-year-old child. In view of the child's lung pathology, a fuzzy stuffed animal would not be advised because of its potential as a reservoir for dust and bacteria, possibly predisposing the child to additional respiratory problems. Scissors, paper, and paste are not appropriate for a 3-year-old unless the child is supervised closely. When teaching the parents of an older infant with cystic fibrosis about the type of diet the child should consume, which of the following would be appropriate? 1. Low-protein diet. 2. High-fat diet. 3. Low-carbohydrate diet. 4. High-calorie diet. The correct answer is 4. CF affects the exocrine glands. Mucus is thick and tenacious, sticking to the walls of the pancreatic and bile ducts and eventually causing obstruction. Because of the difficulty with digestion and absorption, a high-calorie, high-protein, high-carbohydrate, moderate fat diet is indicated. A child with cystic fibrosis is receiving gentamicin. Which of the following nursing actions is most important? 1. Monitoring intake and output. 2. Obtaining daily weights. 3. Monitoring the client for indications of constipation. 4. Obtaining stool samples for hemical testing. The correct answer is 1. Monitoring intake and output is the most important nursing action when administering an aminoglycoside, such as gentamicin, because a decrease in output is an early sign of renal damage. Daily weight monitoring is not indicated when the client is receiving an aminoglycoside. Constipation and bleeding are not adverse effects of aminoglycosides. A 9-month-old child with cystic fibrosis does not like taking pancreatic enzyme supplement with meals and snacks. The mother does not like to force the child to take the supplement. The most important reason for the child to take the pancreatic enzyme supplement with meals and snacks is 1. The child will become dehydrated if the supplement is not taken with meals and snacks. 2. The child needs these pancreatic enzymes to help the digestive system absorb fats, carbohydrates, and proteins. 3. The child needs the pancreatic enzymes to aid in liquefying mucus to keep the lungs clear. 4. The child will experience severe diarrhea if the supplement is not taken as prescribed. The correct answer is 2. The child must take the pancreatic enzyme supplement with meals and snacks to help absorb nutrients, so he can grow and develop normally. In cystic fibrosis, the normally liquid mucus is tenacious and blocks 3 digestive enzymes from entering the duodenum and digesting essential nutrients. Without the supplemental pancreatic enzyme, the child will have voluminous, foul, fatty stools due to the undigested nutrients and may experience developmental delays due to malnutrition. Dehydration is not a problem related to cystic fibrosis. The pancreatic enzymes have no effect on the viscosity of the tenacious mucus. Diarrhea is not caused by failing to take the pancreatic enzyme supplement. After discussing asthma as a chronic condition, which of the following statements by the father of a child with asthma best reflects the family's positive adjustment to this aspect of the child's disease? 1. We try to keep him happy at all costs. Otherwise, he has an asthma attack. 2. We keep our child away from other children to help cut down on infections. 3. Although our child's disease is serious, we try not to let it be the focus of our family. 4. I'm afraid that when my child gets older, he won't be able to care for himself like I do. The correct answer is 3. Positive adjustment to a chronic condition requires placing the child's illness in its proper perspective. Children with asthma need to be treated as normally as possible within the scope of the limitations imposed by the illness. They also need to learn how to manage exacerbations and then resume as normal a life as possible. Trying to keep the child happy at all costs is inappropriate and can lead to the child's never learning how to accept responsibility for behavior and get along with others. Although minimizing the child's risk for exposure to infections is important, the child needs to be with his or her peers to ensure appropriate growth and development. Children with a chronic illness need to be involved in their care so that they can learn to manage it. Some parents tend to overprotect their child with a chronic illness. This overprotectiveness may cause a child to have an exaggerated feeling of importance or later, as an adolescent, to rebel against the overprotectiveness and the parents.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.